spine is twisted a little bit, all they have to do is have perfect technique with lunges and squats and deadlift, and that can rupture or herniate or bulge discs out,
Yeah.
and even cause more inflammation. But the importance of this is that the brain is at the very top. All the nerves go right down the spinal cord, and all the nerves go right up to the different parts of the body. There are so many nerves in the body that they're responsible. If you burn your hand, it causes you to pull your hand back. But if you had, doctor, no skin on you and no muscle, all we had was nerves, I could still tell that this is Dr. Bradford with those cool glasses that he always wears. So, but that, you know, the importance of the structure is paramount to chiropractors. But here again, too, is that you always have to question, make sure that your structure is actually getting better.
Yeah.
Because a lot of times, well, I tell you what, I see a lot of shoddy work out there. So
Yeah. So that's next up on this level, next level up of this therapeutic order is correcting structural integrity. The last three steps are kind of where Western medicine, allopathic medicine likes to hang out. Top of the ladder. So
top of the ladder.
at the very top is palliation, chemotherapy, surgery, heavy duty drugs.
Got it.
And then we have interventions with pharmaceuticals.
Okay.
And then we have interventions with nutraceuticals or supplements and vitamins.
Okay.
So, and I said that backwards, I went from the top down. But as we get more to the top of this ladder, we get more interventions, more invasive, right? And so as a naturopathic doctor, my philosophy, my approach to a patient is, let's start at the bottom. If we've got a sick tree in the backyard, we're not gonna just start cutting off branches.
Correct.
Right, we're gonna go into that soil, we're gonna see what are we feeding that tree,
Right.
how's the root system, you know, is it grabbed hold, is it spread out, or
Sure.
is it just got shallow roots, that kind of thing.
Sure.
So feed the soil first, and then work your way up that tree, up into the branches.
Right.
So,
You know, interesting. Many patients will still think that medication is always stronger than nutraceuticals. And what's always fascinating, and I can take this as when it comes to cholesterol or even blood pressure, is that many times it's experimental. You know, what medication will actually drop your cholesterol, where sometimes the natural cholesterol-lowering nutraceuticals such as Google lipids, red yeast rice, there's the niacin, different things like that will actually sometimes in certain bodies actually be more effective with less side effects.
and you know, let's take it one step deeper on that. With if we're talking about cholesterol, what about fiber? How much fiber do you have in your diet? Fiber will bind up with cholesterol in the gut when it's getting recirculated,
Yep.
and help you eliminate it through bowel movement.
You got it.
So you know, our American diets are traditionally pretty low in fiber. So you know, it's just a different way of thinking.
Right. You know, when we look at this, you know, in kind of hovering above at 50,000 feet and looking down on it, so often we will have patients that will go to, you know, the top feeders, the medical doctors, and you know, we're talking about say what the typical American is, which is you're a fat body, you're have too much stress, you aren't exercising enough, your diet sucks, might be smoking and drinking, and you know, now I'm in Arizona hitting the weed a little bit too much. But these are all things that, you know, a patient will show up to a doctor and they'll look at a lab and say, my God, you're a wreck. You know, your cholesterol's too high, your blood pressure's through the roof, you can't control your blood sugar. You know, you have this, what we used to call syndrome X or metabolic syndrome, where, you know, you basically got one foot in the grave. And so what they would do is, well, let's put you on a diuretic, let's put you on a beta blocker, put you on some statins in order to bring the cholesterol down. And the trouble with this is you're talking about a lot of different side effects.
Yeah.
And in this therapeutic order, when we're starting from the bottom, every single thing that the therapeutic order will build on, you're talking about making the body stronger.
Yeah.
So you need less medication. And believe me that we still see diabetics that go blind, lose fingers, lose toes, lose feet, lose legs.
Yeah.
And that is something that there is no great ending to just relying on medication.
Yeah.
You will see where the body gets very quick at clearancing the medication, and so you have to take more and more until you actually concentrate on what the real issue is.
Yeah.
So Doc, sum it up.
So, to sum it up, start at the bottom. Do the least invasive, most powerful things first, and then work your way up. We don't start at a 10, right? We start down at the bottom. We build up a baseline of health. We raise that water line. The whole ship's going to come up.
That's right.
So build a baseline of health. Get those things out of your life that are preventing you from being able to heal. Then we're going to tap into your ability to heal, and we're going to continue to strengthen you as we go.
Doc, thank you very much on behalf of all of the audience and the patients here at Downtown Gilbert Healthcare.
See you next time.